uterus function once you have adenomyosis?
Yes, so essentially okay, so in adenomyosis, let us say from in terms of if the purpose is to get successful pregnancy, if natural conception didn't work, then IVF. If it doesn't work, then treatment of adenomyosis, which improves uterine function. Uterine function in terms of implantation and pregnancy. So, and or if, let us say, if patient has adenomyosis and they're not planning to get pregnant anytime soon, then they have to protect the uterus. Because in adenomyosis, every month it gets activated and it gets worse and worse gradually. So to protect the uterus, or uterine function, or protect the uterus when patients are not trying to get pregnant actively, then you should use a progesterone, Mirena coil. So essentially two hormones oppose each other. So estrogen is a promoter of adenomyosis and endometriosis. So estrogen is cyclical estrogen is not very good for adenomyosis and endometriosis. Progesterone is opposing factor for the estrogen. So you fight estrogen with progesterone. So, and which is Mirena coil. When you put the Mirena, it directly produces a lot of high level of progesterone. It opposes estrogen effect and it protects the uterus. It doesn't treat the adenomyosis, but stops adenomyosis from developing and keeping its function. So second way of treating adenomyosis, again, reducing the estrogen. So for that, you need to use a like GnRH analog to reduce the estrogen, to give uterus break from estrogen so that uterus heals, then function improves. So yeah, when patients trying to conceive naturally, of course, you can't use this because this, if when you're on estrogen or progesterone or Mirena, they work like contraceptive. This is in the interim period when patients become aware they have adenomyosis, but they're not planning to have kids in the next 3-4 years, then they need to use a Mirena coil. But when they're actively trying to conceive, they should actively try to conceive naturally. If they can, then should do IVF and then transfer embryo, preferably in natural cycles. Accepting lower chance. Let us say your age is 30, your chance for implantation of high-grade embryo should be 40%. You have severe endometrial adenomyosis, you have 20% chance. So instead of having 1 in 2, 1 in 3 chance per high grade, you accept you have 1 in 4, 1 in 5 chance. If you have 4 or 5 high-grade embryos, hopefully with the first or second or third transfer, you get success. If not, then that means that adenomyosis for you is impacting more than expected. So then you should consider banking some embryos, then treating adenomyosis, then transferring. Yes, your chance may not go back to 40% because you had the disease, although you treated temporarily, your chance may go up to 30%, but it's better than 20-25%. So adenomyosis treatment is very much individualized. We created protocol for that 5 years ago. I created protocol for that. So for 5 years ago, we treated hundreds and hundreds of patients successfully using this protocol. And that's actually, you can find the book on the link on Instagram and TikTok links. So in that book, we describe that protocol. So, and if necessary, then yes, 3-stage protocol, banking, then Zoladex or Prostap, then transfer.